Anytime a premenopausal woman experiences a sexual concern, it's appropriate for her to talk to her healthcare provider because certainly it could be a stressor of everyday life, relationship changes, but it could also be from medication she's taking. It could be from an underlying medical disorder that needs to be diagnosed. So maybe the sexual concern is a symptom of this disorder, such as depression or hypothyroidism. And it certainly could be female sexual dysfunction. So whenever there is a concern, a woman should speak to her healthcare provider. So this was a national survey that was done in 2,500 women between the ages of 21 and 49. It was done by Harris Poll and created by the American Sexual Health Association with support from Valiant. And really what this study was looking at is what is the impact of low sexual desire on a woman's life? The findings from that study are consistent with what we've seen in other research studies looking at low sexual desire. You know, it's interesting. If you look at previous studies that have been done, typically you'll see more of a negative impact on sexual function as women approach perimenopause or menopause. That's not really what we saw in this survey. When they stratified the women into two age groups, so 21 to 34 and 35 to 49, they really didn't see any difference in terms of the impact that low sexual desire had on these women's lives. You know, the survey was really interesting because it showed that about just over half of the women in the survey were not very happy with their level of sexual desire. They felt that their sexual desire at the time that they took the survey wasn't close to what it was years ago. So they were concerned about that. They felt that in the majority, around 93% of the women felt that their low sexual desire put a strain on their relationship. A majority of the women in the study felt that the low sexual desire would have negative impact on the relationship. And what I found was really interesting is that, again, a majority of the women felt that they either couldn't talk to their doctor about it or there weren't solutions available. So really interesting findings that bring home the point of it is the responsibility of the healthcare provider to bring up sexual function concerns with their patient. It should be a part of every conversation that we have because we know that not only does sexual dysfunction cause these concerns, but medications we put patients on, medical conditions that people experience can all affect their sexual function. And sexual function for most women is considered a very important component of overall health and well-being. No. So there's two buckets. Women will experience low sexual desire for many reasons. It could be, as I said before, relationship changes, stressors, fatigue, multitasking, medications, hormonal changes, breastfeeding. The list goes on and on. When we're talking about female sexual dysfunction, we're talking about a problem, so a concern, that is chronic in nature. So it's lasting 6 months or longer, and it causes a woman personal distress. So this is a bothersome issue to her. It doesn't get better with date nights. It doesn't get better with going on vacation. And these women will say, I'm attracted to my partner. I love my partner. I want to be there for my partner. But unfortunately, because of the sexual dysfunction, they can't. There are treatment solutions available. We do have, for the first time, a FDA-approved treatment for hypoactive sexual desire disorder, which is the most common form of FSD in women. However, it's really important for women to start the conversation just to even find out if they have female sexual dysfunction and what type of female sexual dysfunction they have so that they can receive the most appropriate treatment solution. And this may be medication, this may be counseling, this may be a combination of the two. I think the most surprising aspect of the survey for me was that the majority of women felt that they couldn't talk to their doctor about it or that it wasn't appropriate because, you know, even though this is my specialty that I work in, and it seems like everyone's talking about sexual health, I realize that this still is not the norm, and it really, again, is up to the healthcare providers to ask the question about sexual function. every year that they see their patients. I think it's got to be a collaborative effort. So as a physician, of course, it is our responsibility to ask these questions. But let's talk about the real world. The real world is that clinicians or healthcare providers have very short amount of time to deal with a number of issues. And sometimes sexual function will get pushed to the sidelines. When that happens, women should always feel like they can ask that one extra question and say, hey, I've got this concern. What can we do about it? I want to let clinicians know, our healthcare providers, it's very easy to take a sexual history in 2 minutes. You're asking a couple of questions to find out if there's a concern. If you don't have time to address that concern, then just say, this is really important. I'd like to bring you back for a separate visit to address it. Or have your referral source ready. Say, you know what, I've got a doctor in the community or a healthcare provider in the community that I can refer you to. Then there's a third option, which is a great new website, which is called findmyspark.com. This is a website that was created by the American Sexual Health Association with support from Valiant. They worked with experts in the field of female sexual medicine to provide tools and resources for women so that they could sit in the privacy of their own home and learn about female sexual dysfunction and take some quizzes to see if maybe it's something that they are experiencing. And what I really love about the website is there's great tips on how to talk to your clinician or your healthcare provider, as well as your partner, about female sexual dysfunction. So if your clinician or your healthcare provider doesn't ask you about your sexual function and you have a concern, be empowered to have that conversation. Go to findmyspark.com, get the tools that you need, and you'll be ready to have that conversation.